Good morning, guys. We're all sparkly. It's my admin day. All my tasks are completed. But I start the day every day with diagnostic calls. And the patients or prospective patients are always thankful that I'm saying, you don't need TRT. So why did you get the blood test? Well, sometimes it's just screening. Sometimes it's because they got negative symptoms and it's not to do with testosterone. And sometimes it is. If it's the latter, obviously we advise them accordingly and we try and make them not need TRT. But if they clinically need testosterone replacement therapy, they come to us and they get delivered gold standard care, baby, microdosing testosterone and HCG, the most effective way of achieving stable male androgen levels. So why am I talking about this one particular patient? Because he was particularly thankful that he didn't need TRT, but he did kind of want TRT. So let's delve a little bit deeper. Now, you need 2 blood tests to diagnose testosterone deficiency. And we always advocate doing the more comprehensive test to start off with, because it provides me with more information to effectively advise you as into what is in your best interests. Because if you have a snapshot, your testosterone could be low for multiple reasons. Or it could be satisfactory, but not actually low, really. Or it could be erroneous, because an acute blood test isn't much use. We need chronicity, which is why we do 2 blood tests. But the first blood test, if it's a comprehensive screen, gives us lots of information, not just your testosterone that can be negatively impacted by lots of things, like a bad night's sleep, by eating. There are lots of companies offering these finger prick tests. They're a waste of time. Absolute waste of time if you want 100% accurate blood tests. So we only do venous blood tests for that reason. We want accuracy, not necessarily convenience. Well, actually, a venous blood test is convenient, because if you ever try to do a finger prick, you'll realize it can be a bloodbath and it can be unsatisfactory. You can't always get the right amount. And if we're going to have to repeat the blood test, you might as well have done it correctly in the first place, which is why we only offer venous blood tests. So this guy, he had a comprehensive blood screen. He had, what did he have? He had the TRT Complete Plus. We offer 2 blood tests. The TRT Complete does everything, but obviously the TRT Complete Plus does everything and some of the essential micronutrients and vitamins necessary for men's health and testosterone production. Again, more information, more power. So this is a 33-year-old guy, and he had this done in mid-June. So we'll go top to bottom. He's an Indian origin, and that's of relevance to the conversation. Full blood count, very normal. Heart health, very normal. Slightly elevated cholesterol. Now, we don't worry about slightly elevated cholesterols, do we? Because cholesterol is the precursor to pregnenolone. And actually, it's all about ratios, not isolated numbers. His HbA1c, so a measure of glucose control over 3 months, was perfect. Kidney health, slightly raised urea and a slightly raised creatinine. So obviously raised urea, he was dehydrated at the time of the test. We say to do the blood test in a fasted state, but not dehydrated. So that means drink plenty of water before the blood test. Just don't eat food, because food can lower testosterone. And his creatinine, 116. When I was a junior doctor, the reference range went up to 120 because we were all a little bit more muscular and healthy. And if you have a high protein diet, you're muscular, etc., or you take creatine, which this guy does, again, more information, more power, that would explain his creatinine alongside the urea. Liver health, slightly elevated ALT and AST, again, can be explained by the dehydration, but always think about everything. It's not ever one thing. And again, you have to have that holistic approach to everything. Everything has to be considered. So be considered. Don't focus on one thing. Iron stores, very normal. Nutritional health. Zinc, normal. Vitamin D, suboptimal. As we said, Indian origin, living in the UK. Now, we have men with vitamin deficiencies who live in Marbella. So get some more sunshine. They get lots of sunshine. So I think pretty much everybody's vitamin D deficient. And if I see a healthy vitamin D, I say, are you supplementing? And it's always yes. We never see very healthy vitamin D levels without people actually supplementing, which is kind of scary. But I recommend vitamin D, zinc, magnesium, omega-3, and a good multivit. I'll do a video about that in the future. Thyroid health, normal. Now, all hormones are dependent, whether that relationship be direct or indirect. So testosterone affects thyroid and thyroid affects testosterone. So absolutely barn door normal. Now is hormonal health, which is obviously the focus of what we're talking about here. We'll get to the nitty gritty. Testosterone, total testosterone, 11.9. So according to the BSSM guidelines, he is a potential candidate for TRT. Free testosterone, again, borderline low, 0.298, definitely not optimal. So then you look further. Now, where is the issue coming from? Well, you look at the LH, FSH, and prolactin. So these are all bang in the middle. So he has a barn door mixed hypogonadal picture. So yeah, the conversation was, you could be considered as a potential candidate for TRT based on your numbers. But we don't want to prematurely start you on TRT. We want to look at optimizing your nutrition, your lifestyle, your exercise, all the things that we bang on about all the time, because you're going to have to do that anyway to feel good on TRT, because you have to put the work into everything. It's always everything, never one thing. And we're always too focused on one thing, but it's always everything. And testosterone allows you to be considered. So with low testosterone, you are even more focused because you're desperately finding or trying to seek a solution. And we focus on low testosterone because I think I've got low testosterone, but that's the end result typically of a lot of things. So yeah, so I said to this guy, we need a confirmatory test. He ticked all the boxes, good sleep, good nutrition, trains regularly. So yeah, he could be a candidate for therapy. Disappointingly, yes, again, at 33. So go away and work on your vitamin D. And I sent him the usual article on how to raise testosterone and the supplements that we recommend, and have a think about what you're about to potentially commit to. So I got off the phone with him today. He organized the TRT protocol, which is a basic hormone profile. It was the only profile I really needed. I didn't need any more additional information. And his testosterone came back very slightly better, 14.8, free T, 0.357. So you could have a very considered conversation with him and say, well, if you've got negative symptoms and if you're doing absolutely everything in your power to normalize testosterone and you've got negative symptoms, emphasis on negative symptoms, you could be considered for a trial of TRT to see if it alleviates your negative symptoms. So what were this guy's negative symptoms? None. He was actually flying. From a physicality perspective, he was hitting PBs. His squat, 220. Deadlift, 250. Bench, needs a bit of work, 120. But these are impressive figures. He was super active, super alert. Actually, his whole life seemed to be going incredibly well. High libido, not low libido, high libido. No problems with erections, no brain fog. So what the hell was this guy seeking TRT for? Well, again, the internet is absolutely flooded with get your testosterone checked. Testosterone is going to do this. It's going to give you what you want. No, it's not going to give you what you want. It's going to give you normality, because normality means physiology, how your body functions. It's not going to give you anything more or less than normality. And we should be aspiring to achieve normality. So again, how your body functions, and then putting the work in to be the best version of yourself. So that's the goal here. So what was this guy seeking? Well, he was seeking an improvement in his body composition. So is testosterone replacement therapy going to do that for you? Well, it's going to allow you to achieve your genetic potential if you put the work in. And if you train for many years, you're going to understand that not all exercise is the same. Not all diet is the same. And you have to adapt your training for your goals. So disappointingly, again, I'm going to say this, Indian origin. These guys aren't massive. These guys aren't ripped. So you can only achieve your genetic potential. I can only achieve my genetic potential. So he wasn't going to get what he wanted, which was to become this monster through testosterone replacement therapy. So we had a very frank discussion about this and about the realistic expectations that he should be aspiring to achieve. And I said it many times in the last video, almost on repeat, being the best version of yourself. And that means looking after your physiology, looking after your psychology to allow your emotions a fighting chance of being positive, but realizing that those emotions are fleeting. And if you work on your physiology and psychology, you are going to be the best version of yourself with the right mindset. Understanding again, here we go. For the hero, fear is both a challenge and a task, and only boldness can deliver from fear. And if the risk is not taken, somehow the meaning of life is violated and the whole future condemned to hopeless staleness. Ultimately, it's your journey to do the right thing by you and me and everybody, because we are one consciousness experiencing itself subjectively. Don't take the path of least resistance. Always be considered. Testosterone will allow you to be considered, but still, it's this that might be tricking you. Take a step back, take a breath, and move forwards towards the light.